Now, in resuming dental care in communities experiencing no transmission or minimal community transmission, dental care can actually be provided to patients without suspect or confirmed COVID-19 using strict adherence to standard precautions, things we were doing before COVID-19. Enhanced precautions whenever feasible, according to CDC guidance, and continuing to stay updated on local transmission trends. Next slide, please. If you're resuming dental care in communities experiencing minimal to moderate or substantial transmissions, that dental care to patients without suspected or confirmed COVID-19 requires using the enhanced precautions, both droplet and airborne precautions. And we'll be talking about those. Now, CDC addresses screening in terms of patients and screening. You want to make sure that patients and visitors have donned face coverings prior to coming into your facility. Provide a surgical mask if supplies are adequate. And ask about the presence of fever or other symptoms consistent with COVID-19, which you should have also been doing in your day prior to their appointment. On site, you want to actively take the patient's temperature, and if that temperature is less than 100.4 degrees Fahrenheit and they are not symptomatic, it's fine to go forward. However, if they're at or above 100.4 degrees Fahrenheit, you should be referring them for medical evaluation unless fever is actually determined to be associated with a dental diagnosis of dental infection and no other COVID-19 symptoms. And again, thinking about fever, fever can vary and it can go up and down. So I think it's important to ask them about the history of fever as well. Ask patients to inform the clinic if they're diagnosed with COVID-19 or develop symptoms, again within 14 days of their appointment. Now, you can ask them to contact, or you may create a policy that you're going to follow up with them in the 14 days. Next slide, please. Now, to monitor and manage dental healthcare personnel, flexible, non-punitive sick leaves are really important. The last thing you want to have happen is someone who is either living with someone who has symptoms and is sick feel that they must come to work, or if they themselves don't feel well and come to work, because they truly could then become the source of a healthcare associated infection. Regularly self-monitor for fever and symptoms, again, prior to someone coming to work. And if fever or symptoms develop while at work, keep face coverings on, should notify the supervisor and leave, and seek medical attention. Screening healthcare personnel at the beginning of the shift is also important for both fever and symptoms. Now, this difference is that the temperature for healthcare personnel should be less than 100 degrees Fahrenheit. And if so, and without symptoms, can go forward with work. But if they're at or above 100 degrees Fahrenheit, again, leave the workplace, seek medical evaluation. Now, you can consider testing, and again, the tests are as good as the day that they're being done on, and some individuals may be infected asymptomatically and may not initially test positive. So testing should be considered, but be very, very informed on the types of tests and the information those tests are providing. Dental healthcare personnel with COVID-19 exposure should not come to work. Notify their healthcare provider to determine if medical evaluation is needed, and then prioritize testing for dental healthcare personnel with symptoms. Next slide, please. Now, with the dental facility, physical barriers at reception areas, and I think you've all been to stores, grocery stores, take out food where you've seen these large plexiglass dividers. That's the same kind of thing you need to consider for your reception areas. So that person who is at the reception desk has a barrier between them and the patients coming into the area. Ensuring you have appropriate signage, respiratory hygiene and cough etiquette signing, face covering signage, hand hygiene, not only for personnel, but for patients as well. Next slide, please. General precautions. So thinking about providing alcohol-based hand rub, tissues, no-touch receptacles throughout the clinic and the facility and in the waiting room, along with that signage. But things are going to look a little different with those barriers at the reception areas and other public-facing areas. Waiting room chairs should be at least 6 feet apart, ideally bringing individuals in one at a time so they're not even sitting in the waiting room, and asking visitors to wait outside of the building unless the patient is a child or an adult who needs assistance. Cleaning it out down to bare areas, toys, magazines, soft surfaces that aren't necessary should be removed. And again, keeping the minimal number of people necessary in waiting areas. Next slide, please. Now, if you're reopening after some prolonged closure, refer to the manufacturer's instructions of all the equipment and devices that you would now be putting back into service. Dental unit water lines, you want to review the dental unit itself instructions, as well as the products or devices that you're actually using to control biofilm in the dental unit water lines, and your frequency of testing the water. Autoclaves, cleaning of equipment, ultrasonic cleaners, washer disinfectors, air compressors, vacuum and suction lines, radiographic equipment, amalgam separators. Again, the manufacturers of your specific devices can be very helpful with the guidance of what should be being done after putting these devices back into operation. Next slide, please. Some of the administrative controls and work practices is that dental healthcare personnel should really limit clinical care to one patient at a time whenever possible. Again, what you're trying to do is reduce the number of people in your dental practice setting to those that need to be there. Storing everything except what's needed for that patient away from the treatment area in cabinets and in drawers. You ultimately are trying to prevent cross-contamination. So you want to go in and look at the things that you have sitting out and ask yourself, do these need to be out, or can we put them in drawers or outside of the room? Now, administrative and work practice controls, again, avoid aerosol-generating procedures whenever possible. Use of things like ultrasonic scalers is not recommended. Hand scaling should be being performed. If aerosol-generating procedures are necessary for the dental care procedure, using four-handed dentistry, high volume evacuation suction, and full mouth dental dams, and then limiting the number of dental healthcare personnel present during the procedure to those only that are essential for patient care and procedure support. Other considerations, ensuring that in your sterilization area, you only have one person at a time to be able to maintain 6-foot distance between staff when they're not directly providing care. Next slide, please. Preprocedural mouth rinses, PPMR, another acronym to learn. There is no published evidence regarding the clinical effectiveness of preprocedural mouth rinses to reduce SARS-CoV-2 viral loads or to actually prevent transmission. But CDC does say that preprocedural mouth rinses with an antimicrobial product may reduce the number or level of microorganisms in aerosols and spatter generated during dental procedures.